This is My Child Will Thrive, and I'm your host, Tara Hunkin, nutritional therapy practitioner, certified GAPS practitioner, restorative wellness practitioner, and mother. I'm thrilled to share with you the latest information, tips, resources, and tools to help you on the path to recovery for your child with ADHD, autism, sensory processing disorder, or learning disabilities. My own experiences with my daughter, combined with as much training as I can get my hands on, research I can dig into, and conferences I can attend, have helped me to develop systems and tools for parents like you who feel overwhelmed trying to help their children. So sit back as I share another great topic to help you on your journey. A quick disclaimer before we get started. My Child Will Thrive is not a substitute for working with a qualified healthcare practitioner. The information provided on this podcast is not intended to diagnose or treat your child. Please consult your healthcare practitioner before implementing any information or treatments that you have learned about on this podcast. There are many gifted, passionate, and knowledgeable practitioners with hundreds, if not thousands, of hours of study and clinical experience available to help guide you. Part of our goal is to give you the knowledge and tools you need to effectively advocate for your child so that you don't blindly implement each new treatment that comes along. No one knows your child better than you. No one knows your child's history like you do or can better judge what is normal or abnormal for your child. The greatest success in recovery comes from the parent being informed and asking the right questions and making the best decisions for their child in coordination with a team of qualified practitioners in different areas of specialty. Today's podcast is sponsored by the Autism, ADHD, and Sensory Processing Disorder Summit. In order to learn more about the summit and to sign up for free, please go to www.mychildwillthrive.com/summit. Hello, and welcome back to the My Child Will Thrive podcast. Today in the podcast, I have for you an excerpt from an interview that I did with Dr. Elisa Song. Dr. Song is an expert in pediatrics. She's board certified, and she has a wonderful approach to how she works with families in a holistic way to ensure that their children thrive. This interview is an interview that can be seen on the current version of the Autism, ADHD, and Sensory Processing Disorder Summit in entirety. Today on the podcast, I'm just going to give you a taste of what you can learn there. If you want to sign up for the summit and listen to all the interviews, including Dr. Elisa Song's, you can find that at www.mychildwillthrive.com/summit. Interviews from that summit and my past summits, as well as masterclasses that we host here at My Child Will Thrive, and my framework that I teach on how to determine what the right treatments and therapies are for your unique child, all can be found in the My Child Will Thrive Knowledge Vault. So you can also get access to that. The members of the My Child Will Thrive Knowledge Vault get ongoing access to the 100+ interviews and masterclasses in a searchable format, so that you can find the information you need as quickly as possible so that you can help your child for where they're at right now. If you want to just learn about the Knowledge Vault, you can see that at www.mychildwillthrive.com. But without further ado, let's just talk about what you're going to hear today on the podcast. Dr. Elisa Song is going to talk to us about all the things that you can do and look for when you're dealing with asthma, autoimmunity, and ear infections, and to eczema, and why she feels, and she also does practice, a functional integrative approach with all the families that she works with in her practice. Types of things that you learn during the entire interview are why we're seeing an increasing rate of autoimmunity, asthma, eczema, and allergies in our children. She talks about in the interview how taking a deep dive on both ours and our children's medical history can actually guide the path to healing for your child. What foundational steps you can take to start the healing process in a manageable way, which is always really important, and what types of immediate, natural, interventions you can use to help your child during a flare of something like eczema or a bout of asthma. What steps you will need to take to address the underlying causes of atopic illness like eczema and asthma, and so much more. So this interview in its entirety is jam-packed with so much information. Dr. Song goes into some of the tools she uses in her toolkit as well to help the families that come to see her. So without further ado, here is a snippet of the interview that I did with Dr. Elisa Song. So it is really hard to differentiate between when it's a normal, or I should say normal regression,
right. Yeah.
Or something like you said, a phase that you think that they might wash out of, but and when we should be really getting aggressive.
Yes, absolutely. And you know what I tell parents is, it's not that there are more of these bugs around. I don't think that there's more strep floating around. I don't think that there's more hand, foot, and mouth virus floating around. I don't think that there's more Lyme, that ticks are carrying. I think it's what our kids' immune systems are doing and and our adult immune systems are doing. They're not responding appropriately to these infections that our body should be able to contain if we're in a healthy state. And that goes back to, well, why is this autoimmunity happening in the first place, right? Why are our kids' immune systems so dysfunctional at an early age, sometimes from birth, right? And that goes back to really then, what can we as, mamas and papas, now, even before we conceive, or, even if, we have a child who has neurodevelopmental concerns and we're thinking about a second child, what can we do, right? That having that second or third child after you have a child with autism or, special needs can be a really frightening prospect, right? Mm-hmm. I have a lot of parents who come to me and say, we really want to have a second child, but we're so afraid that this might happen again. And we don't know that we have the bandwidth to help 2 or 3 children, who have incredible, biomedical needs, school needs, social needs. And so that's where we really look to see, well, what can we do for prevention? What do we know about some of the potential causes and triggers for autoimmune illness? And, how can we set the stage then in this child's developing immune system and body to make sure, to the extent possible, right, that they don't shift over into this autoimmunity.
Yeah. So let's talk about a few of those things, because the same things for preventative can be also applied to, what to do about it. So what do you say in terms of the first things that you look at addressing?
Yeah. I go back to, if I have the opportunity, I tell parents, really, if I could get to parents 3 to 6 months before they're trying to conceive, that's really the ideal time. That's the best time to do prevention, because we know that really the heart of our immune system and the heart of our nervous system is the gut, right? That's what we teach in functional medicine. It all starts in the gut, but there's a backstory to that, right? This baby doesn't just come out and all of a sudden they have the gut that they have. It really starts with that mom's gut, before she even conceives. So that gut microbiome is really critical to establish even in utero. So if that mama's gut is disrupted, let's say she's had chronic yeast infections, or she's had a ton of antibiotics, throughout her childhood and adult life, or she's on a ton of Zantac, for reflux, or having a huge amount of stress. We know that stress alone disrupts the gut microbiome. And then that disrupted gut microbiome exacerbates the stress, because most of our serotonin and our dopamine, something like 80 to 90%, is made by our gut. So it becomes this vicious cycle. And so addressing that mama's gut, making sure that she's eating, a diet that's full of phytonutrients to support her gut lining, adequate levels of probiotics or fermented foods, doing a gut cleanse for yeast or parasites before she gets pregnant, really trying to reduce her maternal stress. We've actually shown, there's studies looking at maternal stress during pregnancy and changes in her vaginal flora. It's fascinating, right? But what mom isn't stressed nowadays? Whether you have 0 children, you're working 80 hours a week, or you have 3 children and you're thinking, oh my gosh, how can we handle a 4th child, right? And you're not really taking care of yourself during your pregnancy. But to the extent possible, having those mindfulness routines, exercising, making that a priority, right? Addressing maternal adrenal fatigue if it's there, because if we as mamas have adrenal fatigue, which most of us do to some extent, but when it's really severe, our adrenals can actually literally start, feeding off of our baby's adrenals. And then we have babies who come out, in this fight or flight mode and much more at risk for eczema and allergies and subsequent neurodevelopmental issues. And of course, vitamin D, making sure that mama is really, really optimized in her vitamin D levels, because we know that low vitamin D levels prenatally is correlated with higher risks for autism and eczema and asthma in our babies. Maternal antibiotic use and maternal Zantac use has also been linked with increased risk for the eczema, asthma, this atopic class of illnesses in our kids. And in fact, if we all bring with us our family history, right? There are some kids with eczema and asthma I see that have zero history. There's no one in the family who has eczema and asthma. But there are some families where, every older sibling, aunts and uncles, cousins, mom, dad, they all have eczema or they all have had asthma. And so that child just, has a higher risk. We found that if moms during their third trimester and while they're nursing take a particular probiotic called Lactobacillus rhamnosus, that she can significantly reduce the risk of that child developing eczema and asthma. So again, goes back to the gut health, right? Now, once babies are born, we have these postnatal factors also that we can modify as well. We can't necessarily modify how our babies are born, but if we can have a vaginal birth, that would be ideal, right? Because coming out through the birth canal, getting exposed through all of that good vaginal flora makes a huge impact. We know that C-section babies, compared with vaginally birthed babies, have very different gut microbiomes within that first 2 weeks of age. And in fact, some hospitals now are doing studies on taking, for the C-section babies, taking a vaginal swab from mama and swabbing baby's eyes, mouth, nose, rectum, right, to colonize that baby, and finding that it actually can be very helpful. So that is a potential option for babies through a C-section birth. But if you do have a baby who was born by C-section, or you received antibiotics for group B strep, making sure from the very beginning, day one, giving probiotics to that infant, and taking probiotics yourself is very important. If there are other reasons for gut disruption, like that baby is very fussy and colicky, and your pediatrician says, they have reflux, let's get them on Zantac. There are times where Zantac might be necessary, but I will tell you, there was a shift somewhere in the early 90s where, in my training, or I should say the early 2000s, my training, never, ever did we put a baby on Zantac for being fussy, or having colic or reflux. All of a sudden, there was this 1 year, I remember, where we had these drug reps coming in saying, look at this new indication for babies who are fussy, get your babies on Zantac, which at that point wasn't generic. And all of a sudden, we had these 2-week-olds, these 3-week-olds who were fussy and colicky, and mothers and fathers didn't have the tools to deal with that. And their babies were immediately put on Zantac. And it does help often, but we have so many tools when we're using an integrative medicine toolkit to really handle that reflux and that colic without turning to Zantac, because Zantac in infants has been shown to have a higher risk later on for that baby to develop eczema and asthma and autoimmunity. Same thing with early antibiotic use, antibiotics before the age of 6 months. Tylenol use has been shown to increase the risk for autoimmunity and atopic illness. So if we can use an integrative medicine toolkit, and this is where, I just visited my not my twin sister, my baby sister, who just had twins herself. And so, and her little babies were going through a really, really hard time with constipation, fussiness, gassiness, spitting up. And her pediatrician had recommended, perhaps stopping nursing and going on formula. And I said, this is not acceptable, right? This is not okay. I made an emergency trip out there. She lives in Denver. I brought all of my tools. I brought, special infant probiotics, including a probiotic called Lactobacillus reuteri, which has been shown to really help soothe that colicky intestinal tract, for babies who have reflux. I brought my acupuncture needles. Yes, you can do acupuncture for infants, and it works remarkably well. I brought some herbs like chamomile and fennel that have been shown to reduce reflux and colic in infants. And I brought my homeopathic medicines. I brought, something called Cosintol, which is a homeopathic combination for upset tummy and distress and colic in infants. And I got my sister on an elimination diet. I took her off of gluten, dairy, soy, eggs, and nuts. And she said, well, oh my gosh, there's nothing for me to eat. And I said, oh my gosh, there's so much for you to eat, right? Let's look at that. Let's look at all the lean meats you can eat and any fruit and vegetable, right? There's so much. And, it takes about 2 to 3 days to wash out from your system, from the breast milk. And in the meantime, we started the babies on acupuncture and the probiotics and homeopathics and the herbs. 3 days later, happy, calm babies, pooping regularly. She's pumping and able to nurse. They're on the breast milk, no problem. And now we're at the point where she's slowly, one by one, reintroducing each food to see, well, what was the biggest culprit? I'm sure it's the dairy in this case. I mean, that's the number one for babies who are refluxy and colicky. And gluten would be the next second. So, and then once babies are older, once they're toddlers and once they're in grade school, it's, really it's really our diet, our standard American diet, that's one of the biggest culprits in creating this inflammation, this underlying inflammation in our kids' bodies. That then once you have this inflammation that's up to here, then you get this infection or toxic exposure like mold or heavy metals, and then the inflammation bumps up to here, right? And then you get another inflammatory insult like emotional stress, which our body can't distinguish the inflammation caused by emotional stress and physiologic stress. That's all inflammation. And then we bump up to here, and now our children, their bodies can't contain it, and we see the eczema and the asthma or the autoimmune phenomena. So to the extent possible for our children as they get older, if we can keep their diets clean, right? Keep out those artificial flavors, preservatives, colors, eating a rainbow of phytonutrients. And I know that some of our kids, the parents listening, their kids are so sensory defensive, and they're eating maybe 3 different foods, and it's got to be the same package of mac and cheese, and it's got to be the very same chicken nugget. But there is a way to do this. Your kids can get there. It's not a race. We just keep taking baby steps. And, even if it means that in a few months you're just licking a strawberry, and holding an apple and just smelling it. That's progress, right? That's progress, and your kids can get there. And then, really pesticides, right? Eating as organically as possible. And I know organic foods are more expensive. So really focusing then on the dirty dozen that the Environmental Working Group hands out. Every year they update their list of the most heavily sprayed foods, and then they have their list of the clean 15, which are less sprayed. But pesticides like glyphosate, Roundup, are highly toxic, not just as a chemical and causing stress on our liver detoxification systems, but glyphosate, it actually is classified as an antibiotic. So every time we eat something with glyphosate, it's going to kill off many of our good probiotics in our gut. Glyphosate itself has been shown to disrupt the junctions between the small intestinal lining. That's leaky gut, right? That's leaky gut. That's food sensitivities.
Well, I mean, I think that everything that you were just talking about, it goes to with all of these kids, the personalized medicine approach is so important. So from prevention through to actually what do we do for our particular child. And that's the challenge for parents, is that they're learning all these things that could be impacting. They're seeing their kids in every description of probably every talk they're listening to on the summit.
Absolutely.
And then they say, it gets a little overwhelming, but the reality is that it does need to be a very personalized approach, and why, you work with your patients to make sure that you have such a comprehensive history, because it does change the way you approach things.
It does. And, the other thing that I would just like to back up and say to any of the parents listening out there, there's so much mama guilt, right? We as moms, I mean, no matter what is going on with our children, we are constantly racking our brains with what did I do wrong? What could I have done differently when I was pregnant? Oh my gosh, was it that tuna fish sandwich that I just had to have when they were, when I was 4 months pregnant? Was it because I cleaned the bathroom, with that cleaner because there was so much mold? We can't go back and change what our backstory is, right? And so, this is just not to have parents feel guilty. It's just to say, there is always a backstory that when we use functional medicine and precision medicine and individualized medicine, we can then go back and say, well, okay, what is this child's backstory? What tipped them over to having this neurodevelopmental illness or this autoimmune illness? And then what's the backstory that we need to unravel? And that's where we get to the true root causes of what happened for that child. And we move on with hope, right? We move on with the knowledge that, okay, once we identify whatever happened to this child and figure out what the root causes are, we need to first deal with our own guilt, right? And just say, all right, this is, I know that this is not reversible, that I can't change, what happened in the past. But what is reversible is the damage that then ensued. And I can do the work that I can as a mama and with my practitioner to really move forward and make my child as healthy as possible. And we can do that. And I do want to say for parents too, there's usually one trigger that we might identify, whether it's that strep throat or that tick bite or, that vaccine, but it's never one thing, right? There's always this backstory of events that happen. And what we see as the trigger is just the straw that broke the camel's back, right? That's the most obvious trigger. But even for a kid who overnight seems like they developed pandas after strep throat, there's something that happened that made that child's immune system just be a little off that then tipped them over, right? But that's what functional medicine is. Functional medicine is getting to that child's story and figuring out what we can do.
Yeah, I think it's very exactly what you said. Is there is a lot of mama guilt, and I always say if I knew then what I know now, but I still go back to saying exactly what you're saying, which is that the medical history is important because it's how we identify how to move forward, and so it's important to unpack that, not have guilt over that, but then leverage that.
Yes.
And it makes a massive difference moving forward when you've really dug into it with vigor. So that's a wrap. Thanks for joining me this week on My Child Will Thrive. I'm so passionate about giving you the tools and information you need to help your child recover. And as they say, it takes a village. So join us in the My Child Will Thrive Village Facebook group, where you can meet like-minded parents and stay up to date on everything we have going on at My Child Will Thrive. This is Tara Hunkin, and I'll catch you on the next podcast or over at mildchildwillthrive.com.